Ladies and gentlemen, welcome. Thank you very much for your time this evening and joining us for the latest COVID update. And I would like to thank Professor David Wilkinson, who's joining for us again for this week to give us an update on COVID and then be able to answer some of your questions. So for those of you who have just joined us, if you'd like to ask a question of Professor Wilkinson, if you just go down to the very bottom there in Zoom in the middle, you'll see a little Q&A box, type in your question. And then once again, if you're on a tablet, it's actually up on the top right-hand side, depending on which version, of course, of the software you're using. And what we'll do is go through David's presentation, and then we'll do a moderated Q&A at the end of it. So without any further delay, can I pass over to you, David?
Thanks, Paul, and good evening to everybody. Great to see everybody again, and our Monday evening get-together on COVID. I'm just going to throw up my slides as usual, and I've got, I think, 10 slides to share this evening. And this week, again, as with each week in this extraordinary journey that we're all on, I think there's a lot of new and different and varied information. So here is the epidemic curve for Australia, the number of new confirmed daily cases in the whole country. And we've been on this journey together now for a couple of months. And as we all know, the number of cases in Australia now is consistently very, very small, and is running at, somewhere between 10, 15, even up to 20 new cases a day. And the epidemic is in many ways, over now in Australia, and almost all of these cases are coming from known clusters here in New South Wales at one of the aged care facilities and the meatworks in Victoria. And there still are occasional cases in returning quarantined travellers, but the amount of community transmission that's occurring, if at all, is incredibly small now. So on our graph that we look at for the cases in the different states, basically now there are only really 3 states reporting any number of cases. New South Wales at the top, Victoria again, and the 2 clusters accounting for almost all these cases. And our friends in Queensland now are enjoying incredibly small numbers and have been for a couple of weeks, as we can see. And essentially in all the other states and territories now, the numbers are either 0 or 1 every now and then. So again, the epidemic, even in New South Wales, which has been carrying about half the load for the whole epidemic, is in many ways, this phase of the epidemic anyway is over. Here is a new graph from that I found this week that I think is quite important and quite insightful. So just to take you through this, the blue line here is the average number of daily new cases, and that's the on the right hand side is the axis for that. So you can see here, as I said, 10 to 20 new cases every day, and you can see here the contributions to the total caseload of the 3 famous clusters: New South Wales, northwestern Tasmania, in the hospitals up there, Newmarch House, the aged care facility here in Sydney, and the Cedar Meats in Victoria. And this, I think, is a dramatic representation to show you the proportion of new cases that are contributed by just these clusters. So, for Cedar Meats here, the red in Victoria, you can see how this has contributed, such a huge proportion of the new cases across Australia. And I wanted to share this because I think this is probably something that we're going to see in the weeks and months ahead. Nobody knows, of course, and this is unprecedented and so on, but from everything we know about this virus now and the epidemic, one would bet good money that this is the picture going forward, is that there will be outbreaks. They will tend to be in these kinds of facilities and they will no doubt be managed very, very well, or one certainly hopes so, as they have been to date in Australia. We spoke last week a little bit about the digital app that the government wants us all to download to help with contact tracing, and about 5.5 million Australians have done that now. As I mentioned on last week's call, one of the very senior professors here at Macquarie University that I have high regard for is involved in the security aspects of that app in terms of providing advice to government on that. I did have a discussion with him. I rate his recommendation highly, and he tells me that his whole work in cybersecurity is around personal security and safety, and he is very critical about these sorts of issues. And his view is that the app is as secure and safe as it can be, and he has downloaded it, so that was enough to make me comfortable downloading it. The way the app works, as most people now are familiar, is it keeps a record of who we've been close to in terms of Bluetooth contact between telephones, and then that data is stored locally and then shared only when we give permission for that, if the health department tells us that we've been in close contact with a person with COVID. When I did a literature review around all of this, I found this very interesting paper, which I would recommend to you if you have an interest in this, from Science, one of the world's most prestigious medical and scientific publications. And they looked at the role for digital, so-called digital contact tracing in an epidemic like SARS-CoV-2. And they make the point, and it's just here in the abstract, but worth looking through the paper, that essentially when an epidemic gets moving, manual contact tracing very quickly is overwhelmed. And if we have digital contact tracing like an app in place, it can increase the efficiency massively, and therefore increase the ability of the public health authorities to do contact tracing. And as they summarize here, by targeting recommendations to only those at risk, epidemics could be contained without the need for mass quarantine. And so I think the answer for the app is download it if you haven't, and recommend it to others. And it really will contribute to control of COVID in Australia. The other thing that's been interesting, we've reflected over the last few weeks on the very high number of scientific publications that are pouring out now, and it's impossible, of course, for any single person to keep across them. Google has come to the party with the COVID-19 Research Explorer, which is an AI-powered website. I've had a very interesting, good play with it. And you can literally ask it questions like the example that's in here: what are the rapid molecular diagnostics for COVID-19? And it will go off and do a search, an AI-associated search, and tell you. So if you're interested in having a play with that, I would recommend it. And if you want to look, for example, at the evidence about whether schools are safe or not, it will take you through the research. So quite an interesting development. Now, as we all know, late last week, Friday, the Prime Minister published the 3-step framework for a COVID-safe Australia. And as of today, all of the states and territories have indicated their implementation of at least step 1, or the parts of step 1 that they're implementing. As we know, some states and territories, WA, Northern Territory, are way ahead of others. New South Wales is going quite slowly, as is Victoria. South Australia is pushing well ahead. And if you haven't downloaded this, it's well worth doing it. It lays out very clearly from top to bottom how in each of the different sectors the health advice recommends moving to a more open, as the PM says, COVID-safe society. So I think what we're going to see over the next 2 to 3 months is, hopefully, all being well, is a move from step 1 to step 2 to step 3, with step 3 taking us to probably the state that we'll all be in for many months to come, with social distancing, hygiene, no large gatherings, and probably some fairly restricted travel. But worth having a good look at that. And many of you will be aware that New Zealand today announced that they are moving to level 2, not the same as step 2, but similar. They're level 2, a much more open New Zealand in the next few days. So, you know, something I think for us all to look forward to. There is a pretty broad view that some states are not going fast enough. And it is interesting that the health crisis is effectively over now. And what needs to be dealt with is a massive economic crisis. The website here, Safe Work Australia, I would draw your attention to that, because I think for all of our workplaces, clinics, GP clinics, skin cancer clinics, anywhere, the imperative now is to develop a COVID-safe workplace. And I think for clinics, you know, it's about developing a safe environment, a trusting environment, consistent practice, all of the staff involved in, you know, setting up if you like, a COVID-safe skin cancer clinic or a COVID-safe general practice, both for staff and for patients. And there's loads of resources here available here and on the GP, the RACGP website for us to do that. But I think that's kind of the imperative now. And it's certainly what we're doing at the university, and businesses around here are all just working on getting the basics right for a safe workplace. I think it's useful for this group to not just sort of trot out the standard stuff, if you like. And I must say, I did have a good giggle at this cartoon that was in the Australian during the week, last week, I think it was. And it says, now on the plus side, we sure beat coronavirus. But of course, the implication is in the process ruined our country. And sort of Mad Max style, isn't it? We're coming over the dunes there, and a Qantas plane rotting in the desert. Clearly, it's not quite that bad yet, but I can tell you from my interactions with the very highest levels of state and federal government at the moment for university business, that there is the most extreme concern about the economic and social impact of the epidemic and the resulting lockdown or stay at home or whatever you want to call it. And, you know, government's focus now is on trying to open up the economy as quickly as possible, while at the same time managing expectations around what's actually going to happen with the epidemic and the, you know, outbreaks and so on, and opening the economy as much and as quickly as possible, but without, you know, creating a second wave of infection. Just reflecting into that is, now that the epidemic in Australia has certainly got through this first phase, here's the distribution of deaths by age and gender. And, you know, as we knew would happen and has now shown itself to happen, the large majority of deaths in older people, all over 70, and most of these, as you know, with other comorbidities. Very few deaths in young people, thankfully. And so finally, just to pull this together, I think I showed this graph last week. This is a graph showing the city map of mobility in the UK, 3 cities in the UK, and showing how people have stopped moving around almost completely, because of course they were told to stay at home, and they did. But that was the last piece that was put in here. And the point, of course, was made that people were changing behavior dramatically once self-isolation was encouraged, social distancing encouraged, and schools were closed, and that the effect that the lockdown itself has had on people's movements is really quite limited. And I sort of put this in because I think we're moving into a phase in Australia now where most people recognize that it is the epidemic is under control. It's time to open up the economy. It's time to get people moving again for all of the necessary social and economic requirements. And this is relevant, I think, because as if you like, for us, the lockdown is eased and things start to change, it's going to be important and interesting to see how that has an impact on the epidemic. So, Paul, I'll leave it there.
Awesome. Thank you, David. So I just want to, as I said, if you've got any particular questions of David, please just fill in the Q&A box at the bottom, and we shall answer those questions in a couple of minutes' time. So David, just I suppose a couple from my end is that it's sort of interesting with, I suppose, the economic side of it, because obviously I think, as you said, that probably the health emergency side of it has moved on. Obviously, we've got the capacity to deal with anything coming forward. It's sort of interesting. So just here in Singapore, so that's where I live and based, and we're still stuck here for another few weeks in isolation of sorts, but we're allowed out as of today, or actually of yesterday, but every time we had to walk into a shop or a supermarket or anything else, we had to use a QR code scan to recognise that we had checked in. And when you go to the checkout, you actually have to check that out as well. Is that something which they have looked to execute within Australia as a tool beyond, I suppose, the contact tracing app, which obviously has limited, as I said, if there's only 5 million people using it, you certainly can't track who has been into where at a particular point in time. There's any of these sorts of more, I would say extreme measures, but let's say these other sort of additional measures to be put in place.
I haven't heard anything like that being discussed or at all considered, Paul. I think they are putting their hopes on the app, and this reflects on Alison's question here as well. You know, my understanding is the intent is that what happens is the app is through Bluetooth is conscious of other phones with the app near it and keeps a record of that. I forget the detail, but the data is only kept for a certain amount of time.
21 days.
You have to, you have to give your permission for the data to be shared with public health officers, as only the public health people can see the data. They would be triggered to ask the question of you if they identify a COVID case, and then they'll do, you know, the contact tracing with you, and then to answer Alison's question, whether you would have to go into self-isolation or quarantine thereafter would depend on the type of contact that you'd had. And so it might range from, you know, just an alert that, you know, you were in Woolworths at the same time as somebody and in the checkout line for 2 minutes, let's say, is a very different risk from, you know, being on the bus with somebody for 15 minutes and so on and so forth. So, you know, I honestly think if we're going to manage the inevitable outbreaks, digital contact tracing is going to be infinitely more efficient than the current method, which is literally phoning people up, asking them where they've been, trying to remember who they, you know, were with and saw or and so on, and then phoning them up, etc., etc. So we can all imagine how long that actually takes. So I think the digital contact tracing is the way to go. But I've not heard of anything like the QR codes and so on. I think, you know, Paul, people like you, Paul, and who live there, and people like me who've been through Singapore many times would see that as quite normal there, and quite not terribly onerous or intrusive, but probably wouldn't go down very well in Australia, I would imagine.
Probably not, but I think it was probably just the next step. It was sort of, you know, I said my experience having them sort of taken action in January, you know, where the whole temperature testing was just put straight in January. And you know, the contact tracing app that Australia uses based on the model that obviously Singapore put in place. So this is sort of the next level up as far as being able to track the populace exactly, specifically, because I suppose the other question about Bluetooth is how accurate is it? I mean, if you're in a 4-story building, does it know which story of the building you're in? It'd be, I mean, I don't know enough about it, but that would be interesting to see. If you're you know, in a high rise, it'll be very, very interesting to see that. So, and look, and just double check if there's any other questions. I suppose the only other thing I just want to make is an observation, just in relation to the economy side of it, because that's the bit that I love to read about and understand. It's interesting to see today in the Asian markets and also in the UK markets that they've been rising, because there's a belief at the moment, they believe it's going to be a V-shaped reception. So obviously crashing down, but then we'll come back up a lot faster, rather than obviously the standard economic cycles, which obviously tend to flow as more of a curve. So I think that definitely that, you know, I think for the next couple of years, it's going to be definitely a challenge. There's obviously many businesses and processes, particularly that are, you know, international travel. I mean, you know, we wouldn't want to be in hotels and airlines at this point in time. But I think it's going to be interesting to see, as you know, they're trialling, or they're talking about at the moment about point of care testing, or as you come into the airport, contactless interactions with the airport of itself. There'll be no hand luggage. There's a whole bunch of other stuff. You walk through spraying, or, you know, so the radiation devices to cleanse you as such, and then get tested at the other end. So it's interesting now that the airlines, and obviously, you know, the UK came out a couple of days ago and said they're going to mandatorily quarantine everyone for 14 days that came into England. Well, the issue is, of course, no one's going to then want to go to the UK, so they're going to have to come up with some options. So David, we've had a couple more questions come in whilst I had that little bit of musing. So just Francis' question about the visual tracking.
Yeah, I think it's a good one, and I think this is exactly the kind of activity we're going to see going forward. Is the ability to contact people if there is an event. So you know, Francis raises the point here, like an education course event. Yeah, I mean, knowing who was in a particular location at a particular time, so that if there was a case and contact tracing needed to then occur, the quicker that can be done, and the more easily that can be done, then, you know, obviously the better. And so yes, I think you know, we're going to, it's a bit like after 9/11, isn't it, where airport security changed forever. And I think that, you know, what we're going to see is a whole bunch of things that will change forever as a result of COVID. And, you know, we will have to figure out as a society the balance between giving up our privacy and balancing that with our safety. And again, you know, with the next question around asymptomatic cases, well, clearly, if the case is asymptomatic and not detected, then the app doesn't help. You know, we know now that such large numbers of cases of COVID are asymptomatic, or at least are infectious while they're pre-symptomatic. So the app would help there, of course, and would be very good there if somebody does develop symptoms. But if people remain completely asymptomatic, really the protection there is social distancing and personal hygiene. So as Brendan Murphy says, you know, 100 times during every press conference, the way we all wash our hands is going to be completely different for the rest of our lives. And I think that's absolutely right. And I think we're going to see social distancing for a long, long time now. And I think these are just some of the ways that our world is going to be very, very different. And so, you know, my sort of wrap up for this, for those of us, you know, involved in and working in clinics, is settling into a rhythm and a routine and a set of work practices that minimize the risk and maximize the safety for both staff and patients. And it becomes the new normal and the rhythm and way of working. And, you know, telehealth will be part of that. Maybe special sessions for elderly people, you know, frail elderly, you know, will be part of that. Many of the things that many of us have already done. I think we're moving into that phase.
And I think the other thing is obviously just from a clinic perspective, typically we know when people have turned up, as in checked in, and typically have, checked out. So as far as a practice or a business that actually knows who's come through the door and when they were there and if something was to arise. And I think the other thing, sorry, about the Singapore example, the QR code, is every business can say when a person walked in the door and when they walked out. So if there was something to arise, it's not, how many of these people did we apparently might be able to track via, a tracing app if they've chosen to download it. We 100%, so the condition of opening your business is you can verify who's come into your door and when they've walked outside the door. And that was one of the conditions of businesses being able to reopen in this part of the world. So I think once again, you got to remember Singapore's gone through a second wave. They've now had over, 20,000 cases. It's, thankfully only 20 deaths, but massive load of cases. So that's sort of part of the conditions of reopening. So I think that, as I said, if we did have a second wave or something like that was to occur, we might see additional levels. And maybe once again, people will, from giving up some of their freedoms, or at least from a privacy perspective, understand that's just the new world, as you said, post 9/11. How we travelled changed, and obviously now this is going to change forever as well. Awesome. All right, I think we have one more. Sorry, David, just scrolling down the page again. All right, so Francis, your question around Singapore's blind spot. Well, I think so the blind spot Francis is relating to, so 89% of all Singaporean cases are in the foreign worker migrant population, right, which there's 300,000 foreign labourers. And basically in round one, they looked at the local population and focused on that and everything else we did, but didn't really, I suppose, focus as much on the foreign workers that live 20 people in a dormitory, in these particular areas. So what's happened is it's obviously gone through there and just gone right through the entire thing. Thankfully, they're all relatively healthy. And as I said, there's only been 20 deaths in total in the entire Singapore, even with 20,000 plus cases. So I don't think that in Australia there is. I think that, as I said, we probably didn't, there's no subgroup of the populace like that exists as they do obviously in certain other parts of the world. And I think that, as I said, the big issue is going to be importing people into the country. That's going to be the next, scary aspect. And obviously until they can get it really sorted out as far as how we can bring people safely into the country, that's, I think, going to be the next, area of concern. As I said, I still think there'll be mild outbreaks and, as I said, clusters, but all very manageable in our very controlled island, which is an awesome place to be right now in comparison to other parts of the world. David, any other closing comments?
No, I think that's good. I agree with your response there to Francis' second question. I think where we will see outbreaks here inevitably is aged care facilities. That's the risk, the high risk setting. And, the sad truth is that often those infections are introduced by health workers, aged care workers. And then, as you indicate, Paul, it's all about border control, because fundamentally, if the borders remain closed, then cases won't be imported. So you're not going to see cruise ships in Sydney anytime soon. We're going to see very restricted international travel in Australia for quite some months, I think.
And I mean, one of the things the government obviously just talked about on Friday is in their step 3 is looking at international students coming back into the country. I mean, how do they think that could actually, or how would they do that? Because ultimately, to me, if you can bring an international student, why can't you bring it in the international tourist of sorts? And if they sort of come up with strategies as to how that might be able to be done? No, it's early days.
Yeah, we're working on that right now, and the answer's easy in that everybody does 2 weeks quarantine. Yep. It's as simple as that, and of course, no tourist is going to want to do that. So that's it's as simple as that. Nobody will get in unless there's 2 weeks quarantine under the exact same conditions as there are now, with police guards, accredited facilities, food brought in, no self-isolation, no amateur hour stuff. It will literally be 2 weeks quarantine.
Awesome, can't wait to do that sometime later this year. And just the last question from Abbas. So how sure can we be that the government will use this app only for tracking COVID purposes?
Well,
it goes back to your comment at the beginning, probably from your colleague, correct?
Yeah, I mean, look, I guess I look at it this way. We can't trust cybersecurity is a problem. Everything gets hacked all the time. We all know that. We saw that with the census. We see it with websites all the time, so on and so forth. So can we be sure about that security? No. I look at it this way. I don't really care who knows where I am. I don't go anywhere or do anything that is illegal or immoral or unusual. So I just don't really care. And I'm actually personally quite happy to have that data stored for a period of time in a secure setting as possible, so that if I'm in contact with somebody with COVID, they can let me know. So I think that's the balance. For me, it's very straightforward. If it was more intrusive than that, then it would be a different story. But for me, that's the way I look at it.
So the data's collected for 21 days and held with the state health officials. So it's not, Commonwealth has no access to it. Yeah. So as far as anything being hacked, it's all, once again, and so probably that information on those sort of places of ill repute, David, that you're mentioning that you may not visit. It's still going to be running shut after step 3 anyway. So you might be rushing back there in the short term. All right. Well, look, ladies and gentlemen, thank you very much for your time today. Thank you, David, also very much for your time today. I've got a session coming up this week with Kelly on accounting related matters as far as the business side of things are concerned on Thursday, and then David will be back here again next Monday. So I hope you all have a wonderful evening this evening, and I look forward to seeing you all very soon. Thank you.